Hi friends, I am Dr. Pratap Sinato. I have done MD in Pharmacy Medicine. In this video, we will discuss about hallucination and illusion. Hallucination, again, one of the common symptoms in cases of any unsound mind, suffering from unsound mind, any mental disorders. By definition, hallucination is a false perception by senses without any external object or stimulus. So, the definition it means that the senses, so body senses perceive things falsely. So, like a sight or just, hearing or touch, any senses, they perceive things falsely in case of hallucination without any external object. So there is no external object or stimulus. In like visual, there is nothing present but person sees something, or in touch hallucination, there is nothing touching in your body, but even then you feel something is present on your body. That's the false perception. So the senses perceive things which are not present as present. They are purely imaginary and may affect any or all special senses. Causes of hallucinations, it may be big altered state, any altered state of consciousness like organic psychosis, in case of high fever, schizophrenia, epilepsy, drug intoxication, any drug intoxications, depressive disorders, or in case of withdrawal from drug addiction also, they experience hallucinations. Now coming to types of hallucinations, first is the visual hallucination. So visual association it involves the sense of sight. So the person it involves the eyes. In this condition, the sufferer experience or visualizes non-existing sights. So here the person's eyes are normal, but the senses of the eyes doesn't perceive things which are absent. Like example, he observes something without anything being present. Like person may see a plane, say see a plane flying in the sky when there is none. There is a clear sky is present, but the person perceives that there is one plane is flying above him, or he think he may is sitting in a room and he may perceive some person is sitting in front of him. Those are some examples of visual hallucinations. So visual hallucinations are commonly seen in organic mental disorders, delirium tremors, focal CNS lesions, toxic disturbances, schizophrenia, and some drug withdrawal symptoms. Next type of hallucination is auditory hallucination. Here there is a false perception of the sound. Usually noises are may include music also. Here there is no sound or there is no any type of sound is present. Even then the person perceives some kind of sound or some kind of music. The person hears voices or sound without any source. They are commonly seen in function disorder like schizophrenia, delirium, psychotic mood disorders, or some encephalopathies also. It is commonly seen. Next type of hallucination is olfactory hallucination. Again, this is related to smell. The person primarily involves the smell and odors. There is a false sense of smelling. So the person perceives some kind of smell. It may be pleasant smell, it may be unpleasant, it may be sweet, sour, or bitter. Any form of smell may be present. Even though there is no external stimulus, there is no smell. Other person was perceiving, but that person perceived that smell. There without any source. Again, they are seen in case of schizophrenia and some temporal lobe epilepsy conditions, but olfactory hallucinations are seen. Next type is gustatory hallucination. They involve the taste sensation. Without any food or a drink, the patients experience different types of tastes. So even though there is no food or even though he is not taking any kind of fluid or anything in the mouth, the person perceives some kind of taste. It may be pleasant or it may be unpleasant. Gustatory hallucination is seen in case of organic brain diseases and some temporal lobe epilepsy conditions. They are seen. Next type is tactile or haptic hallucination. Here it is involves the touch perception. Sufferer experience crawling of insects or rats over his body without any such thing happening in reality. So the person usually perceives that some form of insects like ants are crawling on his body or rats are moving over his body. That type of thing he'll feel. Commonly seen in case of drug withdrawal symptoms of alcohol, and also seen in case of chronic cocaine poisoning conditions. They are also named as cocaine bugs condition, where the person perceives that some insects are crawling on the body and the person constantly scratch over the body till even he may damage his skin and tissues. It is seen in tactical hallucination. Next type is psychomotor hallucination. In this condition, there is a feeling of movement of the part of the body, like a limb, though in reality there is no such movement. The person perceives that some part of the body is moving, though all the part of the body he may be sleeping or they are stationary. Now coming to other types of hallucination which are not commonly seen, but they are also seen, like command hallucination, where the person is ordered by hallucinatory voices to do things or acts which may be frightening or dangerous. So the person perceives constant voice hearing, like auditory hallucination, like a command, and that command he hears and he does that act. They may be pleasant, but more often they are unpleasant. Command, he receives certain commands like go to gang person, kill a person, such kind of command may be present. A person from unpleasant hallucination may be incited to commit suicide or homicide also. Based on this command, the person may commit suicide or he may even may commit a homicide. Microptic or macrotopic hallucination, where the person perceives smaller object as bigger object or bigger object as smaller object. Again, this is a variant of visual hallucination where though the object is present, but here he perceives differently. Sexual hallucination, where the person feels sexual gratification by unfounded self-imaginary objects. But just by imagining, the person feels sexual gratification even though there is no external object is present. Medical importance of hallucination. Based on hallucination, the person may commit some kind of violent acts. He may commit suicide or he may commit any act may be committed. But usually he is not held responsible since he is not liable for he is of unsound mind. Now coming to other next type of common symptom is illusion. This is slightly different from hallucination. The main difference between hallucination and illusion is that in hallucination there is no stimulus. So in hallucination there is no stimulus or external object, but in illusion there is stimulus is present. So there is some form of external object or stimulus is present. Definition is it is a false interpretation by the senses of an external object or stimulus which has real existence. It means that the person, if there is some external object is present and the person interprets is differently, that is a false interpretation of that object. For example, the person may perceive a dog as a lion. So the dog is an external object, but he interprets as a lion. He hears the notes of a birds and imagine them to be of human voices. So here he hears some bird voices and imagines to be human voices. Imagine strings hanging in the room to be of snake. So again, the person sees some strings hanging in the room and he thinks that they are snakes like that. So there is some external object is present and he interprets those things as the other objects. That is the illusion. Illusion are features of psychosis. So mainly the following type of psychosis is commonly seen. They are also seen in aging, behavioral, delirious state. So though illusion is common, a normal person can also perceive illusions, like in a dark room, he may perceive a curtains like a moving person or any person is hiding behind the curtains. He may perceive that illusion by falsely interpreting the object present, but after that he may confirm it by touching the object and may confirm that that is not an object. So same person may experience illusion but is capable of correcting the false impression. But the person who is of unsound mind continues to believe in the illusion even though the real fact is clearly pointed out. So the like based on that he perceived that like a rope has a snake and he constantly in the fear of that rope, feeling that snake will attack him and he may be constantly in that fear. It will continue. Normal person may perceive illusion but will overcome of that fear. These are my references. Thank you.